Hello everyone, today on this lecture we discuss about the community health center. Earlier we discussed sub-center and the primary health center. So in discussing we said that those cases is not managed in the primary health center or in sub-center, that will be referred to the community health center. So why community health center? Because there is a specialist doctors are there. So here cases are referral cases managed, and also the specialized healthcare, optimal specialized healthcare is provided in the rural population. So if you get to the definition, so it is a secondary level of healthcare to provide referral as well as the optimal specialist healthcare in the rural population. So those who are not managed in the sub center, primary health center, because in the primary health center there one doctor is there. So if the case is not managed in the primary health, he need a specialist care or specialized consultation, then can be transferred to the community health center. So it is well equipped and well professional health professionals are there. So it is, in other words, if you say it is the upgrade version of PSC, it's just upgrade version of the PSC because it is well equipped and also the well health professionals are there. It serves as a gatekeeper for all referrals because as is welcome, its door is always open for all the cases that refer from sub-center and the primary referral. That's why it is called as a gatekeeper for all referral. And it is also known as first referral unit. Many times this question is come in the Vivas, the first referral unit. So what is first referral unit? The first referral unit which provide emergency or the health services, the health services round the clock. So this is here we get the diagnostic services and also the emergency cases are managed. So the blood bank facilities are there. So this is called a first referral unit. So community is also known as community health center is also known as first referral unit. And this community health center, the maintenance and the establishment is run by or is managed by the state government. This is come under the state government. State government is responsible for the maintenance and the establishment of the community health center for the smooth running of the community health center. So here is the inpatient health services is provided. So here is 30 bedded hospitals is there because the inpatient health services is going delivered in this community health center. Next one, staff. There as it is well equipped and it's mean most staffs there about 46 staffs are there in that is the essential health, the essential, and 52 desirable staffs are there according to the Indian Public Health Standard. So IPHS, what is maintain a quality. He want to maintain a quality care or the standard of care that will be delivered through the PSC and the community health center. That's why according to the IPH Indian Public Health Standard, the desirable staff must be there is 52 and essential that will be 46 staffs should be there. Within the 46 staffs we will find one of the medical officer is there, block medical officer is there, the pediatrician, one of the pediatricians there, gynecologist is there, and medicine specialist, one of the medicine specialist doctor is there, surgeon is there, and anesthetists are available there. So this and other staffs, if you included other staffs, there are about 46 staffs are there in the community health center. If you see the establishment criteria, so it is about in 80,000 population in the, it is established in 80,000 population in the Hilly tribal area and 1.2 lakhs population in the plain area will got a community health center. So it is a referral of the 4 PSC because under a one community health center there is a 4 PSCs are there. Okay, as you earlier discussed, under a PSC there are 6 sub-centers are there, but here in the community health center there is under a community health center there are 4 PSCs are there. 4 PSCs are there. Okay, So next we will see what are the health services are delivered in the community health center, because as it is providing what referral and also the specialist care, so it maintain its deliver service of routine health services, and the emergency health services are also be available. So first point is care of the routine and the emergency cases in the surgery. So as a surgeon, good surgeons are there, so OPDs, daily OPDs is there. At the times in the morning and afternoon the OPDs are available, and also the cases who comes in emergency like dressing, appendicitis or hemorrhoids, any intestinal emergency, so that can be managed in emergency in the community health centers. Next one, care of the routine and emergency cases in the medicine, because one of the medicine specialists are there, so it's also provide OPD services are available, and also emergency cases like fever, cerebral malaria, dog bite, snake bite, poisoning, that the organophosphate poisoning, congestive heart failure, ARI, acute respiratory infection, burns and shock, that case also be managed in the community health center. So this is the care of the routine and emergency cases in medicine. Both the things, this is the same thing, that the care of routine emergency. Here is providing the surgery, second one is the medicine. So it is very easy to remember. Next one is the maternal health. So maternal health, already know, is providing the antenatal, before delivery, during the time of delivery, and the postnatal. So these are three, it's a package. So his service is provided in the maternal health. Let's see in antenatal what should be provided. So at least minimum 4 ANC antenatal checkup should be done by the pregnant woman or in the community health center. So first visit should be when will become the first visit, that is early 12 weeks, as early of 12 weeks for the registration of the mother in the community health center. Second visit, that is about 14 to 18 weeks. Within this period, in between these weeks, mother will become and for this second ANC. Third visit must be 28 to 34 weeks, and the fourth one, that is the 36 to terms. And the next is called the delivery. The delivery during the time of delivery, so institutional delivery or the hospital delivery is advised. So 24 hours delivery services are provided. If any surgical intervention is required, if required, then cesarean section can be done. That also be cesarean section can be done in the community health center. And also the pathogram in the labor room, the pathogram facilities are there, by which we can measure the intensity, frequency of the labor, that can be judged or that can be supervised in this in the labor room by the pathogram facilities are there. Next, essential newborn care just after delivery. So the neonatal resuscitation is very important, as there is a available of pediatricians are there. So the service of neonatal resuscitation just after delivery, newborn care, that can be provided, because as there is a newborn corner, one of the newborn corner is present in the labor room and the OT. So that services is being managed or delivered through the community health center. Next, the postnatal visit. So 2 postnatal must be there. If the mother is not come, then we can send our ANMs to visit at the home. Next, breastfeeding, educating the mother about the breastfeeding, how they will be for the just after delivery, early breastfeeding should be started. Next one, immunizations just after delivery, the oral polio, BCG vaccination, and other vaccines should be available in the community health center. So educating the parents about the immunizations, that also be given. Then Janani Swasthya Yojana, that is the motherhood intervention of the SHEP motherhood program through the NHM, that will be delivered in the community health center. Similarly, Janani Sishu Suraksha Karyakram, that is JSSM, that also be provided, that the services also be provided to the community health center. And routine checkup, routine emergency care of the sick children, those who were those not the sick child or underweight, or you say the breastfeeding is not sufficient, so that case will be managed in this community health center. And to find out the malnutrition, which is very important, so that will be services also be delivered to the postnatal visit to the mother to be provided. Next one, family planning services. Here we get the full phase of family planning services is provided in the community health center, and counseling the parents or the couple for the vasectomy, permanent method of sterilization, that is a tubectomy, and if the husband for the vasectomy, so that also be provided, that can be done in the community health center. And also the safe abortion through the MTP, the Medical Termination Act. By this termination legally, we can provide the safe abortion facility through this community health center. Blood bank facilities are there, because here, as you are managing the emergency cases, surgical cases, and the delivery, so there will be required of blood should be required in the time of surgery or in delivery. So there is a facility of blood bank facility should be there. There is a storage of blood should be available. In any emergency, we can get the blood through this blood bank. So this is blood bank facility are available in the community health center. Next one, implementation of the national health programs. A number of national health programs are going on, like National Malaria Control Program, revised National Tuberculosis Control Program, Filaria Control Program, the National Blindness Control Program. So these are the programs that are going on. So how this program should be reach to the people, or if you require any peripheral smear for malaria, or any sputum test, or any diagnostic test, so that all the services are provided through this community health center to the beneficiary. So this is the implementation of the health program. Next, the school health services. So school health services were educating the school children about hand hygiene, then deworming, giving them the dose of deworming in the school, and also the vitamin A prophylaxis are also be available, provided in the school children's, and anemic to find out the early case of anemia, so that also be services provided through this community health center. Next, the diagnostic services, as there is this is well equipped, one of the well equipped hospital, so it is providing it's a well equipped services is providing. So there is required for the diagnostic like X-ray, ECG, ultrasound, and blood test, urine test, stool test. So these are the diagnostic services are be there at the community health centers. So by this way, we have full coverage we are providing in this community health center. So it is just the offer or the upgrade version of the PSC, because here we get the more staffs and the well equipped hospital, and also the good health professional, the specialist doctors are available in the community health center. So this is all about the community health center. Thank you for watching, and please keep on subscribing.